Tens of thousands of junior doctors across England have begun 3 days of industrial action over pay. They may be called junior, but in reality they are doctors right up to, but not including, consultant level, and many have decades of experience. And they make up a large part of the medical workforce, around 40% of staff. So this strike will affect operations and appointments right across England. What they want is the 35% pay rise. The British Medical Association, their union, says junior doctors' pay has fallen by a quarter in real terms over the last 15 years. But the Health Secretary, Steve Barclay, says the union's demands are completely unaffordable. The strike began this morning at 7 a.m. and will continue until 7 on Thursday morning. Our health editor, Hugh Pym, reports now from the northeast of England.
Junior doctors on the picket line outside Newcastle's Royal Victoria Infirmary. Part of the most extensive strike action so far in the current NHS pay dispute. For the first time, all forms of care, including emergencies, are affected.
I'm very passionate about the NHS.
Eloise and Amna explained why they had joined the action.
I feel so strongly because we are losing staff. We are not giving patients the care that we want to give them. I go into work. I see a 10-hour wait. I see so many patients waiting to, be treated by us, but there's only so much that we can do.
We need to improve how many doctors we have on the floor to help with the patients, because the care they're receiving is not the care we want to give. We want to give them everything we can, but we can't.
Have you got the notes for the lady in bed 3?
A dozen miles away, this hospital, like others, is trying to do its best for patients.
Hello, Elizabeth. Hello there, my name's Dr. Sykes.
Elliot, who's a consultant, is seeing Elizabeth.
Much better because I'm here.
Good, okay. And what's been the problem?
I'll go about it.
Good.
But Elliot says redeploying consultants and others to cover striking junior doctors hasn't been easy.
It's been hugely disruptive and time-consuming in terms of the preparation. In terms of actually the days of the strike, yes, it has been very disruptive. It's involved a massive number of additional consultant staff.
Around England, patients are facing cancellations. Maxine, who lives in Hampshire, needs a knee replacement and was due to have an appointment today, but she'll now have to wait 6 months.
Devastating, because as far as I can see it, my world exists sitting in that chair, struggling to the bathroom, getting back in the chair. My life's come to a halt. And my daughter came round at the weekend and said, "Let's go out, Mum." I didn't want to go out, I can't. It's just so painful.
There were picket lines at many hospitals, including Hull and in Swindon, with junior doctors ranging from the newly qualified to those with several years' experience.
Other health unions are now in pay talks. The BMA and ministers were in contact over the weekend over the possibility of negotiations, but that came to nothing.
We stand ready to engage with the junior doctors on that in exactly the same way we have with other health unions. And I urge the junior doctors to come and have those discussions as the other health unions have been doing, so we can pause the strikes and discuss those issues.
The union claims there were too many conditions attached.
He wanted to talk about pay this year, which might be a one-off payment, which goes completely against the premise of our dispute, which is the erosion that we've seen over the last 15 years. So we want to address that erosion just to reverse the pay cuts that we have.
In Scotland, junior doctors will be balloted on strike action. The BMA says an offer in Wales is not good enough, and in England, further action is likely if there's no movement by ministers. Hugh Pym, BBC News, Newcastle.
Well, it's not just junior doctors who are on strike this week. Teachers go on strike in England on Wednesday.